Are you seeing my, I hear the recording in progress. Are you seeing my screen, guys? Is that showing okay? Yep, able to be there. All right, awesome. So I'm really excited for this kickoff. And the didactic is going to be relatively brief. The way we do the echoes is to have just a little bit of education, and then we'll get into case discussion. And so we thought for the first one, we would just kind of go over the basics and a little bit of formulation, in particular, thinking about why we moved towards this kind of a CBT and family systems echo. And the big why, when we think about our kind of vision and sort of philosophy for CBT, the first part, of course, is that we believe recovery is possible. We believe people with psychosis can live full, meaningful, and satisfying lives. So that's the one part of it. The second part of our philosophy is really about believing that relationships founded upon shared purpose and collaborative learning supports recovery and develops community. So there's a lot in there, but two of the big parts of that, so what helps is having a shared purpose, kind of a combined reason for doing things. And then the collaborative learning really kind of encapsulates a lot of what CBT is about. And also it kind of parallels what ECHO is about. ECHO is about all teach, all learn. All right. So we're all students and we're all teachers in that kind of sense. And that's really what CBT is about. And when we talk about moving it to the family system piece, typically CBT is thought of in kind of a dyad, right? Therapist and client and the growth and learning and recovery that happens there. And this echo kind of reflects that, expanding to really bring in the family system, all right? Really the community that's there as part of that. We know families have a huge influence. And so kind of widening that lens. And the echo sort of reflects that, right? Initially we did a lot of these trainings. It was either Val or I with a single agency and doing a lot of consulting and training in that way. And this is really expanded as well. So we're going from one trainer to one agency to multiple trainers to multiple agencies and really trying to harness the kind of collective wisdom, skills, talent. There's a lot of talent out there, and bringing that all together to figure out ways to kind of help people move towards recovery, and community in the sense of families also being a big part of that. So that's kind of the philosophy piece of this. The other part of the didactic, I'm just going to talk about a little bit about CBT-P, and this is stuff that you already know, but just kind of as a reminder. And by the way, this information comes from a briefing from Kate Hardy that has a lot of stuff on CBT. You can go to the link and check this out, a fact sheet on it, which is a really nice tight summary on this. But CBT is all about the alliance. There's a lot of action-oriented interventions that are occurring during CBT, a lot of guided discovery and Socratic dialogue. Again, that process of learning things together, not knowing the answer and giving answers, but sort of exploring things together. Formulation is at the heart of CBT, and formulation is really just a fancy word for kind of understanding how certain sort of processes, certain behaviors and experiences sort of develop, and what we can do to try to change that process. CBT has a structure, which we use a lot of strategies, and there's of course homework. So just quick review on those pieces. Just a teeny bit on why the relationship is so important. And this comes from a kind of a working group through the APA, what elements of psychotherapy are really highly effective. And if you look at the first three at the top there, the alliance, showing accurate empathy, and collecting and delivering client feedback in the kind of larger research that was conducted through the APA, show those to be very kind of positive elements that are effective within psychotherapy. And on the right-hand side, I just say the CBT elements that we emphasize a lot, that befriending, socializing, engaging, doing accurate reflections with psychosis, which can be challenging because the content can be at times off-putting, and then having a review process built into our structure. And then, of course, the shared meaningful recovery goals is a central part of how we think about helping folks move towards recovery. Just a teeny bit on the structure of CBT, and this is all going to be familiar to you guys. On the left side is the kind of traditional CBT structure. If you read the Beck books, where you always set the agenda right away after a mood check, bridging with homework. Then the center part is really the work of therapy, and at the end is homework and feedback parts. And as you're also familiar, we've tried to simplify that in a way by using something we call START. And the S part is the socializing, engaging part. Target is the agenda setting part of it. The action phase encapsulates a lot of the strategies and the collaborative learning. And then at the end, there's always time for some review and feedback so that we can always gather a sense of, what the client is learning from the session and get their feedback so they can help shape what CBT looks like moving forward. And then, of course, having some take-home work as part of that kind of unified structure. And just a reference point there from Akamoto that adherence to CBT structure is associated with positive treatment response. Now, while structure is important, it's not the only thing. We've got to be flexible with it, but we still want to have that structure there. All right, moving along. So just a little bit about formulation. CBT is transdiagnostic or adiagnostic in the sense that it doesn't matter what the diagnosis is, because we're always going to start with trying to understand a person and how they're responding to a situation. So in whatever situation they may hear a voice, then we're going to kind of look at, how do they think about that? How do they appraise that? And then how does that link with what they're feeling, and what behaviors follow from that initial experience, the thoughts about it, and the emotions that are experienced. All right. And so this is all familiar to you guys in terms of the CBT structure. So I'm not going to spend a lot of time on that. Just another brief review on the layers of thinking that can influence behavior. And at the surface, and that's where the maintenance formulation starts, is those automatic spontaneous responses. So I hear a voice and I get a thought, oh my gosh, it's the devil. So that's that automatic thought underneath that kind of pops in there right away. Beneath that automatic thought process are layers of thinking. There's intermediate thoughts, which are things like attitudes and rules and assumptions, rules like it's bad to have the devil talking to you, or assumptions about if I'm having this experience, it means I'm crazy or maybe possessed, things like that. There are certain assumptions and rules that we kind of develop to help us navigate our world. And at the core of it, or at the sort of base, are these things we call core beliefs. And these are developed very early in life. And they're usually summarized in a statement like, I have worth and value, or I'm worthless, I'm loved, or I'm unloved, those kinds of real core sort of beliefs. And I emphasize that for two parts. One is that, it's the family system and culture that helps to shape that very early on. And the other piece too is that we have a saying that voice content is sometimes the royal road to core beliefs. Very often the content in voices can reflect these deeper sort of themes that resonate within a person's life. They kind of come through the surface more quickly that way. So just a little bit on the different layers of thinking. One of the things that's really important in CBT is understanding maintenance formulations. And by that, we mean what keeps the distress going, because if we can understand what keeps distress going, we can then think about where we intervene to stop that cycle of maintaining the distress. And so an unusual experience happens, like a hallucination, or it could be just an odd experience. The person interprets it in a certain way, threat, danger, and certain thinking errors kind of come into play here, like jumping to conclusions and things like that, which leads to distress, which can often then lead to safety behaviors. And if you remember, safety behaviors are things like avoidance or reassurance seeking, things like that, hiding away, some of those kind of safety behaviors, which in the short term may appear to be helpful, but really over time, they're increasing distress and really not helping the situation. So a lot of CBT is understanding and finding those patterns. When we move to a larger formulation, this should look familiar to you, is our making sense formulation. And this is from Kingdon and Turkington. And this really is a way for us as the therapist to work with clients to kind of figure out like the bigger picture. So what were the predisposing factors that were evident early on that may have predisposed a person to developing psychosis? And could be things like having family history of psychotic experience or very early traumatic experiences. And then there are precipitating factors, what was happening right before psychosis emerged, and then perpetuating and protective factors. And spend a lot of time here really, because the perpetuating factors are those maintenance variables, what keeps the cycle going. And then the protective factors, what are the strengths and what might help here? Looking at those two parts of the formulation are really, really important. Within there, and again, there's more information about like targets, what's important to the client. And again, moving from that diet, like what does the client want to achieve, to thinking about like, okay, the family's involved. How can we bring the family on board or other system in their life that can help support that, all right, and see where that's going. Clients' values, and again, depending upon their age or if they're still living at home, what's the family's values, and trying to understand how those can kind of work together. And then, the other parts are in there we've already kind of talked about, with a place also for underlying concerns, core beliefs, things like that. If a person has a real sense of self as being ineffective, that's going to be important for us to know as CBT providers and including family, because how can we create little or help them have many experiences where there is success and they can integrate those little successes to have a little different view of themselves, modify that underlying belief about self, right? Just as an example. So in this picture, and I've been sprinkling it in as we've been going along, but adding family to the formulation, and you know, there's a lot of reasons why this is a valuable thing to do, but the family certainly influences the client, you know, from a very early age in terms of culture and belief systems in a lot of different ways, but also, you know, in the day-to-day living, they can have real significant influence. And vice versa, thinking about the client and their illness influencing the family system. What happens when you add stress like that to a family system, and how things can get imbalanced and how the two can go together. So really just a very basic premise. We also know from the research, and Danelle will talk about this more in the next echo, about why family stuff. We know that including family is really, really helpful in terms of positive outcomes. All right. And so it just makes sense on so many levels to include that. So if we think about maintenance of distress through a systems lens, what we start to expand our lens of thinking is, you know, there are situations that activate hallucinations. Sometimes it's boredom, sometimes it's stress at home, but that leads us to home environment, right? Like, what is that home environment? What's activating, and what might reduce those kind of symptoms? The beliefs about what those unusual experiences mean often come from family system kinds of thinking. And at times, family or others at home may be reinforcing certain aspects of that belief. All right. So understanding what that is really important. When we look at safety behaviors, you know, family may influence safety behaviors, and they may be impacted by safety behaviors. A common one, and I have clients with this experience where, you know, they have concerns of voices telling them they're going to kill their parents. And so they call their parents repeatedly to get reassurance. And what happens is when the reassurance is given over and over, it kind of, that's sort of a safety behavior that maintains the distress. And it's also disruptive to home too, because mom and dad or whoever's answering a lot of phone calls and saying, yes, we're fine, that kind of thing, which can create a cycle that's also becomes stressful in and of itself. So understanding that in our formulation, we can then begin to target interventions that includes a wider system when we work with them. All right. So that's kind of the gist of what I wanted to say in terms of thinking about CBT in general, widening the lens, and really the goals for this echo is to reinforce and expand CBT skills and strategies. And as I said, all teach, all learn. There's a lot of talent in this Zoom window that we can kind of share across agencies, which I'm really looking forward to. And then expanding knowledge and skills for including and working with families within a CBT-P framework, because it's not explicitly talked about in a lot of the textbooks, although it's there. But not a lot of clinicians get that sort of family training. I certainly did not as part of my training experience, and have been grateful to have Danelle as an office mate, and you know, Valerie kind of working with me throughout the CBT stuff, because they have a lot more family background stuff. So it's been really helpful for me to think about ways to integrate working with families in different ways in the CBT framework. So that's kind of what we're about. And this is just sort of the intro didactic. So I'll take a question or two if we have any, or we can then move on to the